unprecedented time, we've had to change the way that we interact with people, the way that we seek out services, and businesses have had to change the way that they operate. Now, I know for myself, every time I go to make an outing, I am jumping on Google, pulling up the business, and saying, what are their new policies? What is it that I can expect in this new experience? Am I allowed to bring someone with me? Is there social distancing? Are they wanting you to wear masks? Is there some sort of pre-ordering that has to happen? A call ahead for curbside? Trying to be as prepared as I can so I don't run into any of these weird situations or end up frustrated, to be quite frank about it. So how do we make sure that we're setting these same expectations for our patients and providing them with the information that they need to know that the experience is going to be different?
At the Dental MEP, we use science to teach people skills to you. Do not forget to subscribe to our channel and don't forget to hit the bell so you never miss out. Our patients' experience at our practice during the time of the pandemic is going to change. And we want to make sure that our patients understand what that is going to look like before they come to the practice. So this is a little bit of an uncomfortable conversation for some of us, and there might be a list this long of differences in what their treatment is going to look like, what the check-in is going to look like, checkout. There's so many different things from a patient perception. Even the PPE that we wear is different for them. So do we have that conversation with them before they come into the practice, or do we wait for them to get there? I really, really, really want to stress that we should be having this conversation before they come to the practice. We've all had that experience before where we wish we knew something in advance, and we just don't want our patients to be having that feeling as well. So choose discomfort over animosity. Choose to have an uncomfortable conversation in advance, then take the risk of our patients feeling uncomfortable when they get there.
So these are going to be those conversations such as, who's going to be able to accompany you to the appointment, if anyone? Is there a person who needs to accompany you to the appointment? This is going to set us up better as well to know what to expect. They're going to hear the screening questions again. When shouldn't they come into the office? I know that, like we said in the intro, these are things that we have been looking for with businesses. We want to make sure we're giving our patients that same information, so then when they're walking up to the practice, they know. Should they actually be staying in their car and calling ahead? And we're avoiding any of that chaos that could arise from not having the information ahead of time.
We all have those really sweet patients who come in super early. They're very sociable. They love visiting with us, and they probably have not been seeing people. So now they're going to love even more to be visiting with us. Again, an uncomfortable conversation would be letting that patient know in advance, specifically to them, that we won't be able to have that visitation time. That if they want to schedule time on the phone or something, if you need to add extra time in for that patient, go ahead and do it. But if they're the person who comes in early, making sure that we let them know in advance that that's not going to be acceptable. If you maybe, typically have a little bit of leeway for people who are running late, and now it's a no way. If you're a minute late, you're not going to be seen. Having that uncomfortable conversation. Some individuals at the front desk, that's an uncomfortable conversation. They usually let the patient come in late and then go ahead and grab Chassie, the hygienist, and say, hey, your patient's here. Do you want to see them? Nope. Okay, you go tell them. And so knowing that in advance, who likes to have these conversations and who doesn't, and practicing these uncomfortable conversations in advance so that we can make sure that our patients aren't going to be upset with us or have a horrible experience. It's just going to be a different experience.
And one of those things, Christina kind of just touched on it, but saying no is hard to do. It is not an easy thing. We love to be able to accommodate and say yes and move the schedule around. And right now, we all know how hard it is to have been able to even get the schedule to a way that it actually functions. So we may have to say no on occasion, and practicing what that sounds like or how you're able to convey that, what the process for then getting them rescheduled looks like, just feeling really comfortable with it. A lot of our front office team members are the faces of the practice that love interacting with our patients and never want to have that no conversation. So just running through it. Do a role play. It sounds silly, but it's so much better to be prepared than caught off guard.
And with all of this is going to be the changes in treatment that these patients are going to go through. So now your patient has finally gotten to the practice, and what else is different? We see PPE has changed, and my treatment care has changed. So my hygienist is no longer polishing my teeth, and this may not be what you are following, but a lot of practices, we're not doing polishing, we're not using the ultrasonic scaler, We're
Mhm.
using a rubber dam if we're in the doctor's op. We might now have an assistant assisting hygienist, which is different. We might now have an evacuation device that goes in front of the patient's
Mhm.
face like this. So the experience is very different for our patients. And I know for me personally, and many people out there, I love getting my teeth polished. When I was in assisting school, we used to do it on each other every single day before we knew that it would actually, scrape away the enamel. I was like, oh, okay, good to know. We won't do this every single day, but it felt so good. And a lot of our patients really look forward to that clean feeling, and they attribute that clean feeling only to be with the polishing or with an ultrasonic scaler. So what's really important is having the conversation in advance that our quality of care has not changed, but how we're delivering care has changed. And so I want to say that again because I want you to use that when you make your phone calls. Okay? Our quality of care has not changed, but the way that we are delivering care during the time of the pandemic has changed. Use that when you're calling your patients. Make sure that they're knowing in advance because it's going to be much more difficult for them to say, my teeth don't feel as clean, why are you not polishing? And then try to backpedal and have that conversation with them.
Yeah, so those are two big conversations. What are the safety factors that have changed with the appointment? How is it that we have that conversation? And then what has changed in the delivery of care? So, Christina, great verbiage. The quality has not changed. The way that we are delivering your care has. And then being prepared to have a little bit more of a conversation. What does that kind of look like? Is maybe it means that there's not going to be an ultrasonic, but really ensuring that you're able to reassure them that there's other measures that have been added to ensure that quality stays the same, although the procedure may look different.
Where are we going now?
I don't know.
You just talked about like safety. I thought that was a good one because you didn't write it down. Because safety is, remember, our patients have not been 6 feet close in a long time. They're talking about like this may be the very first time that they are this close to someone.
Okay, that's a great point.
I thought that's where you were going with safety.
Sorry. Nope. All right, but we can do that.
Yeah.
Okay. I'll start there. We want to keep in mind that our patients have not been 6 feet close to anybody in a while. So there's a lot of things that are going to create this feeling of vulnerability. One, they're going to be closer to someone. We are going to be sitting right next to them having a conversation. The second is if they have been wearing a mask consistently, we're going to be asking them to take a mask off as well. So they're going to be close to you and they are going to remove that mask. So those are all the things that we have been conditioned to perceive as that's what's protecting us. So even if we are placing so many measures in place that reduce aerosols and provide safe care, their perception is going to be that those are the safety measures that are protecting them. So making sure that we are prepared to have that conversation about what those new measures are that protect them from aerosol generation as well.
This would be one of those practice conversations for when a patient is in the practice. So we have before they get to the practice, and then what kind of conversations could come up when a patient is in the practice. And so your patient, again, like Chastity said, this might be the first time they're close. They have to take their mask off. What might a patient say? Well, what we've been hearing from people who have been open for a while is two things. Either a patient is concerned that they're at risk by taking their mask off, or they're concerned that you're at risk by them taking their mask off. And patients have been asking that. Is it safe for you to be this close to me? Or is it safe for me to be in here, with everyone else who's in here? And it's really important for you to practice that conversation with your team so that everybody knows what they're going to say if a patient happens to ask a question like that. We want to make sure that we're able and comfortable to talk to our patients. And we know in advance, some of the things that they're going to be asking us and acknowledge that.
And some of them might even forget that they have the mask on. So
please take your mask off.
As we lay them back, we have to say, could you please take your mask off? It's one of those things.
They're not just going to go under it? They're going to go around it?
We've been conditioned to do for the last few months now. So making sure that we're really being empathetic to those components and taking the additional time to really explain those differences, those expectations, and reassuring them of their safety as well.
Now, I'd like to go over a heavy-hitting conversation that needs to happen before the patient comes in. And this is one that is quite controversial, so please don't start throwing tomatoes at me for having this conversation. It does need to happen.
I don't know where she's going with this. I'm nervous now. I'm nervous.
PPE charges. If your practice has decided to implement PPE charges, we're not here to tell you how to implement them, what the cost should be or why you should do it or why you should not do it. If this is something that you have chosen, It's really important that your patients know this in advance. We always try to let our patients know an estimate of what things are going to cost before they come in. Why wouldn't it be any different now with PPE charges? And again, because we feel uncomfortable about it and we feel like maybe we'll just deal with it there, or we'll just slip the charge in and see if they call me later, choose discomfort over animosity. Choose to have a productive a proactive conversation with your patient in advance. Now, because this is a really heavy hitting topic, we've created an entire video on PPE charges. Make sure to check it out. It's going to help you walk through how to get your team on board with communicating it the same way to patients, and how to communicate to your patients in a way that they can receive the information.
Okay, so you're listening to this and you're going, now I have how many patients that I need to reach out to let them know all of these expectations for?
Yeah, I think front desk wants to tell us right now.
Be creative with the way that you're communicating these messages. It really is going to depend on your patient base, what their age is. I know for me, as I go shopping, I am always pulling up my iPhone, so I know what the policies are for our local greenhouses, for our local salons, for picking up shampoo and conditioner and all of that. So if you have a patient base that's going to jump on their phone, make sure use your Facebook page, use your website. If you have a text communication software or email communication, send out an email blast. Let them know what the expectations are for how their visit's going to change. Send them a text message that says, hey, check out our website to see what's changed during this time. But making sure that you are getting that message out there. The modality may change based on your practice.
Yeah, if you have it already set up, then it makes it really easy during confirmations, whether you do electronic confirmations or over the phone, that you get to say, please make sure you check out our website. And the person can go, oh, okay. For any of the updates, they'll go and they'll check it out. And if somebody doesn't, if they're like, oh, I'm not really website savvy, you can say, okay, I'm going to send you a letter in the mail in advance. So you have all of the changes in front of you and you understand. And if you have any questions, give me a call. Again, it's just all about having this conversation in advance with our patients. We want them to kind of make a whole mock-up of what this experience is going to look like, so that when they come in, they have at least, created in their mind a little bit of it, versus not, knowing anything and having so much uncertainty. We already have a lot of anxious patients as is. And again, like Chassie said, this may be the first time that they're going to be 6 feet close to people. So we want to make sure that they're as comfortable as possible and they know that we're taking all the precautions that are necessary and that we're still delivering quality care to them.
So how are you letting your patients know what to expect? We want to know, what ways are you communicating with them? What factors are you touching on? Leave it in the comments to help out those fellow practices out there that are looking for guidance during this time as well. And don't forget to subscribe to the Dental MVP and like this video.